Anytime I go anywhere, they always ask me, who? I'm very good as a former colonel, so if you don't like it, go to YouTube, search for Red Jones Rapper, and hear all about it. It's not PG, so it's being prepared. So I'm honored to be here with you. I'm a retired Army Colonel, did about 30 years. I had the great honor to work with Colonel, retired Barry Forbes, and another Colonel, back to back, Mike Johnson. There he is, thank Mike. Great to see people we served with, what a bond that it creates. So we're honored to be with everyone today. My biggest accomplishment, though, is that I have a son as a captain in the Air Force. I gave you applause there. Now, if I said Marines, they didn't wait. They just do. And a daughter in the Army. That's what Marines who, I love Marines, I tell you. But I'm most proud, even of what they're doing is they continue to serve our country in some incredible times. Next slide. That brings me up to thanking all of you. So if you are a veteran, active Guard Reserve, or still in the active Guard Reserve, would you please stand? Every once in a while, we need to pause and thank those that have volunteered, put on our nation's uniform, and say thank you. And this is another group I'd like to recognize. If you are a spouse of an active Guard Reserve or veteran, would you please stand? So you really have served. So great job. Somebody that recognized there. It's great to recognize those that serve and those that serve others. Part of the reason we're here, this great event, these couple of days, and we're going to share some moments together. You know, in a world of clicks and comments that seem to drive our life, Mary told me, she says, I really want us to have a conversation. And really connect with each other. Coming out of COVID, did a lot of things virtually, and that's wonderful, and thank goodness for technology. But it's great to get together again and have a conversation, not just a bunch of comments or likes or clicks. So it's great that we're doing that today. Next slide. So a couple housekeeping notes, and really as a facilitator and master ceremony, I'm a glorified traffic person. So one of the things that I wanted to know, if you have cell phones, please mute them or turn the volume down, put them on vibrate. And if you need to take the call, we all understand that. Just excuse yourself and please go out in the lobby area and take care of that. There will be a question and answer session at the end of each one of our major elements of the town hall this morning. And we're going to have microphones, we'll have some sort of staff walking around, and just raise your hand, we'll bring the microphone to you. On the table in front of you, there's some little 3x5 cards. I believe there's some that were handed out. If you have a comment, you don't get to ask a question, you don't have time, or you just don't want to. You want to put a note in there, you want to make a comment. If you'll find one of the folks that are with the Washington State Department of Veterans Affairs, or just give it to myself, see me walk around. We'll collect those up, and we'll make sure that Mary gets those and get them up to Alfie as well. Okay, so make sure you're aware of that. At the end, we'll have this gigantic QR code, which we all got familiar with. They were popular before COVID. Now you can't go to the restaurant, you have a menu, there are all these QR codes. At the very end, we'll have this literally 8-foot QR code. We'll all just take our fancy phones, point it up there, and take a little 2-minute survey to let the staff know what did you like, what worked really well, what could be improved on for the next event. So you want to constantly be making it better. Next slide. And we talked about times when we served in. These are difficult times. We all in this room probably know the stats, the alarming factors about veteran suicide. And so anyone that's here, you don't have to be in crisis to call the crisis line. And we all wanted to get the word out that it's now 988 is the new number that you have pushed along. You have that long 800 number. 988 equals 1. Again, you don't have to be in crisis to just ask for help. You're not weak if you ask for help. You're strong by making yourself and your team stronger. So make sure that we're getting that word out about the new number. If anyone during the period of time here need to talk to someone, just need somebody to listen. Let one of our staff know. If you just want to talk about something, then that'd be a crisis. And next slide. So the purpose of the town hall is really to get together back again the Department of Veterans Affairs, Outreach, Transition, and Economic Development was here about 3 years ago in the Puget Sound area to help focus on economic development for our veterans, their caregivers, spouses, and those transitioning off of active duty into a guard or reserve role or to a veteran role. This is the culmination of 3 years worth of work. And you're going to hear about 3 different roundtables that were working over 3 years, the advancements they've made in many of the areas that were identified as challenges years ago. This was right before COVID began. They continued to work. They did not let that obstacle slow them down. And they have produced an amazing amount of output and results. I think as Alvin would say, results is what matters. And they're going to be able to talk to you about some of the amazing advances that have been made over the last 3 years. Next slide. Next slide. This is our agenda. I did it intentionally really small so you can't read it on the screen. Thank you. Now that I'm looking at it. It says we're going to have a lot of speakers. How about that? Next slide. At this time, we're going to hear back from one of those amazing speakers. Let me just tell you a little bit about her. We didn't get to do justice for Alfie. Now, I pronounced her name Lourdes, and she goes, "There's no Lourdes, there's Alfie. Alfie's in the house." So Alfie is what she liked to go by. She said for her friends, and I think we're all friends here today. She is widely known by her friends and colleagues as Alfie, the director of Washington State Department of Veterans Affairs. She's a member of Governor Inslee's executive cabinet and chairs the Washington State Military Transition Council. She leads statewide efforts for a seamless transition of military service members and their families to the Washington State community. She's a member of the Governor's Results Washington Design Team, which addresses the effectiveness of state services to Washingtonians. She's native of Puerto Rico. She served 22 years on active duty in the United States Army. She's a recipient of the Army Legion of Merit. Loosen this up. Legion of Merit, you all. Okay. Yeah. Hey. Military Order of Medical Merit. That's pretty impressive. It's somewhere you don't. She's going to tell us about that. The Governor's Distinguished Management Leadership Award and the Department of Veterans Affairs Secretary Leadership Award. She is currently serving as the executive member of the National Association of State Directors. All her peers recognize her amazingness. Oh, that's the right word. Amazingness. And the National Association of State Veteran Homes. This time, please welcome our friend Alfie.
I was told that I had 5 minutes. I guess I have only 1 left. Outreach, transition, and economic development. I mean, this is an office that started nearly almost 5 years ago. And I will tell you that I was there when the first and still the only director, Cheryl Walls, started putting that office together. So it's important for us to be able to recognize the fact that we have incredible partners not only in Washington State, but also in Washington, D.C. Although we are the better Washington. I'm going to tell you that we have over 200 partners in Washington State. And we have been doing a lot of work together across our spectrum when it comes to multiple services. But being able to connect to OTED and being able to work together in improving the quality of life of veterans and their families and their veteran experience when it comes to connecting to the benefits and services is really important to us. We'll tell you just a little bit about the Washington Department of Veterans Affairs to be able to kind of start putting together this puzzle. We have over 28 programs in our agency, all supported by people like you, by many of you. You're part of our WDBA family, from LGBTQ to operating a farm, to having over 100 beds of transitional housing for a state agency, and nobody else has that, to a program that has been over 30 years for counseling and wellness with over 40 counselors across the state. You start getting the picture? It is really important work, the one that we do in our State Department of Veterans Affairs. And the fact is that we would not be able to do it without you. Lately, we have an LGBTQ program because our LGBTQ veterans need to be able to get some extra help. We've been asking for assistance to be able to get a women veterans coordinator full-time. We have a part-time one right now. We have a veteran businesses program coordinator. And in addition to that, we have the first in the country military spouse liaison to be able to look at the issues of employment, child care, and all those things that affect our exiting service members and our veterans. All that's supported by the governor, our legislature, and by you. And I will just be here for a long time talking about the kind of programs that we have. But again, we would not be able to do any of those without you. And therefore, we celebrate the fact that we partner with OTED and we partner with incredible friends like our Seahawks, from which we have two representatives in here. We have the Senior VP for Outreach, and we have our veterans person, Mike Flood, who is the Senior VP for Outreach, for the Seahawks, and Neil Gray. I'd just like to say thank you for everything that you do. And I hope that you get a lot out of this because that's what we're going to be doing for the next 2 days. Thank you.
Thank you, Alfie. Now we know why she's the best in the country. And she keeps things short, right? We all have a great day. I want to see is Prince here? I think he's on the way. He's somewhere in the National Forest. He's out here, so we're having a park issue. So let's. I want to see if Mr. Stephen Strode can come and speak for a little bit for Chris while he's here. And Chris is here. There he goes. Come on, Stephen. Stephen, I will read Fritz's big bio. Now, Fritz's name, you see it on the screen, so we're going to have word bingo. I'm going to assume that Stephen knows how to pronounce it, but if any table gets it, you win an extra bulk of the Washington Veterans Affairs brochure to take with you. We spare no expense for this conference. So, Stephen, would you please talk to your group a little bit?
Yeah, thank you. I'm Steve. Last name, Singham. But Kurt's unfortunately the director of the Seattle Regional Office, the U.S. Department of Veterans Affairs, couldn't be here at this time. He will be here later on in the day to give his presentation. But I am the service center manager, so I handle the compensation benefits. I handle spousal VA benefits. this. I'm very, very happy to be here with Alfie and you all. I want to echo what Mike said. Thank you all who have served. Thank you all who have been family members of those who served. Thank you all who never had a chance to serve for one reason or another, but are serving people now. I really do appreciate it. As far as what we do at your Seattle Regional Office, we are very, very happy to be here talking about things that really, really affect our veteran community, those at-risk veterans, those veterans that find themselves at extremes of mental illness or whatever circumstances that might lead them to make a terrible choice. We can all put ourselves in their shoes, but yet we all want to do what we can to help. And for those rural veterans who are out there in Seattle, but we see the veteran community that is out there, and we really want to make sure that we are making connections. We are having those communications open. As far as VA compensation, I can say that it has never been a better time to file your claim. There's never been a better time to talk to someone and say, hey, you know what? Put in your claim. Don't just say, no, I wouldn't get compensation for that. Let us make that decision. We are processing claims faster than we ever have. But more than that, we are making more outreach. We have more ways to communicate with veterans, and we have more openings. So the Congress passed, and President Biden just signed into law the PACT Act that he's going to open up more venues for veterans to file their claims. So it's not just those veterans who served in 12-4 or burn day exposure, but also there are more and more localities that we are conceding Agent Orange exposure. It's not just years ago, it was just boots on the ground in Vietnam. We also have the 23 nautical miles off the coast of Vietnam. Those blue water Navy, and also those bases in Asia and other places where Agent Orange and those toxins were handled. We are also processing our appeals, and what we call appeals, the decision reviews faster than that. Again, I would love to yield back some more time. Thank you for having me up here. But thank you all for being here. Honestly, please reach out. I'd love to make some connections. Thank you.
We'll be hearing from him. Just did he work on a roundtable, so thank you for filling in. Some stats that Washington and Stevens' office have received over $1.5 billion in benefits to Washingtonians. There are over 580,000 veterans in the Washington area. And Stevens' office has over 800 employees that are serving our veterans in Washington to deliver that $1.5 billion. But it is a shame when I talk to veterans who are traveling in different places, and I hear them and I hear their service. I know what they're eligible for, whether it's claims, whether it's education, whether it's voting, and I've asked them, well, what's your claim status? I've never done that. I said, brother or sister, you're leaving money that you have earned as a earned benefit. It's not a giveaway, it's an earned benefit that our country bestows on our veterans and their families. Please take that step, as Stephen says, file a claim, let them determine what you are eligible for, because in some cases, in some of our veterans, it's a life-changing compensation that they get, life-changing compensation. So please take advantage of that. This time we're going to introduce Dr. Larry Pruitt. Dr. Pruitt is the Director for Suicide Prevention Programs at the VA's Puget Sound Healthcare System and lead Suicide Prevention Coordinator for VA's 4-state Veterans Integrated Service Network, encompassing Washington, Oregon, Idaho, and Alaska. Before joining the VA in 2018, Dr. Pruitt led the Department of Defense Suicide Event Report efforts from 2014 to 2018 as a part of the National Center for Telehealth and Technology, as well as the Defense Health Agency. He has served on several state and national work groups focused on suicide prevention, including the Veterans Benefit Administration Economic Initiative Summit, the Military Suicide Research Consortium, the Department of Defense VA Data and Surveillance Work Group associated with Executive Order 13822, and many others. At this time, please welcome Dr. David Pruitt. Larry Pruitt, sorry.
Faces that for some I've only seen on a computer screen, and I've seen for the first time the person just handed the trip. If I haven't said hi to the person, please find me afterwards, and if I haven't met you yet, please introduce yourself. I'd love to get to know all of you. I also want to just offer thanks to the WPD team specifically. I've already done that, but you all have done a tremendous job here, and hopefully you all submit vacation time afterwards. All right, my name is Larry Pruitt. I am part of the Puget Sound. I'm honored to be able to represent the Puget Sound healthcare system on behalf of our director, Dr. Blanche, who unfortunately cannot be here today. I wanted to just paint a little bit of a picture for you about the Puget Sound healthcare system so you know what I'm going to say at the end of this, kind of how that makes sense. Okay. So VA Puget Sound is comprised of 10 facilities, and next month, September, it's actually going to be 11 facilities. We're opening a new clinic in Everett. Clinic might be the wrong word, it's more of a small hospital. We're really excited about that. VA Puget Sound, so the western half of Washington State, supports 156,000 veterans. Of that 156,000 veterans, over 120,000 of those receive primary care services at the VA. It's a huge number. We have 7 centers of excellence ranging from substance abuse prevention to 3 printing of medical devices, supplies, and prosthetics. We operate 2 community living centers for our elderly or veterans needing long-term care with specific dementia-related programs. We are one of 3 VA centers with a bone marrow transplant program. We have a spinal cord injury hub. We have a regional amputation center. We are the largest VA women's health program in the Northwest. We're also the 4th largest research program across the entire VA system. And each year, we train more than 1,700 healthcare trainees. Nurses, nursing students, social work students, psychology students, psychiatry students, medical students, all receive training through the VA and all job to the rest of their practice. Of particular pride to me as our lead for suicide prevention, we are also the 3rd highest referral center for the Veterans Crisis Line. So you saw the number 988. We have the 3rd highest call volume in the country. And you might be thinking, why is that something to celebrate? I'll tell you why. It's because that means the veterans in our area are aware of the crisis line, and they are willing to call the crisis line. And that's a huge deal, because we can then start those intervention services and start that crisis response early on before things really become a true emergency. So I mentioned all this to just show that we are invested in our veteran community. We are invested in your community as this work that's happening at the state level, the work that's happening at the nonprofit level, the work that's happening at the municipal or private agency level. We understand the value of partnership, and it's becoming a growing focus for us as a healthcare system. I'm going to share a personal story now. I said I'm the director, so I mentioned everything. Well, no, it's that story. It's not that story. I'm going to share a story about my family. So I grew up in this morning from the Tacoma area, and I know a lot of folks stay overnight. I went to drive this morning. My son is starting high school, and so we had high school orientation, and part of that was high school football. And I'm saying about high school football. You know, we all know football. It's not a big deal. It's another practice season. That's where it's all life. And I sat there as the coach was kind of giving a spiel about the team. And it struck me how they have students, 150 students on social team, which is a huge team. 9th, 10th, 11th, and 12th graders. 4 different middle schools. A number of folks who are moving into the district for the first time. And you have like 2 weeks to get ready for the first game. And I think, how have you done this? How have you got that many people from that many different backgrounds working together for a common goal? And the answer became pretty clear once he started talking. It's like, put the team first. That it's not about the individual. It's not about any one person's success. It's about the success of the team, and that the team becomes even ahead of winning the games. It's about how do we function as a unit. And so I think that relates to what we're doing here. And I know we talk about the title is not just serving those who serve. If there was a subtitle to that, I'd say community partnership. So the biggest thing that you're hear about certainly would be OTED. Partnering in communities is such a big part of what we've been doing over the last couple of years. So I'm excited to share with you what we've been working on, and I'm really glad to be here today.
I really appreciate your remarks, but really appreciate what you're doing. The third highest recognition and utilization rate for that resource. That's amazing, because we go to a lot of states and they're reporting, and you wonder, is there any outreach to make sure that word is getting out? And so kudos to your team and to the Washington State Department of Veterans Affairs for providing that resource for the veterans and family members, caregivers in Washington State. At this time, it's a great honor to introduce my friend. When we started working on this together, she shows up on the video, the screen for the team meeting that started planning this. I said, I know that. That's Mary Ford. That's Colonel Forbes. And the last time I saw her on video, she was a colonel, and there was a 3-star general on the other side, and it was a quarterly meeting, and her lead, she commanded recruiting, and she was like second in the country. And I think she said at some point, General, we're blah, 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 and this, and I don't even know why we're on this call, sir. We're doing good. And so she was an amazing leader there. She does a great job advocating for the veterans of Washington State. She is in the role of Assistant Director of Veteran Services for WDVA. She champions federal and state initiatives to end veteran homelessness, very close to her heart. Over the past 4 years, those efforts have resulted in communities creating expanded capacity to serve our homeless veterans and significantly reduce the number of them in the state of Washington. In 2014, due to her many years of community engagement, listen to this, Mary Ford was recognized by the White House as a Woman Veteran Leader Champion of Change. In June of that year, she received the Governor's Award for Leadership in Management, and she is a retired Army colonel, served on active duty with the U.S. Army and the Washington Army National Guard for 26 years. Her guiding principles in building partnerships, to fostering productive relationships, she will tell me all the time, Teamwork makes the dream work. She believes in partnership. She believes in what we're doing here today. Please make welcome Mary Forbes.
Thank you, Mike, for, maybe exaggerating a little bit. I can't believe I would ever say that, but potentially. No, it really is an awesome thing for your energy here today, because that's what we're all about, the sum of the parts. We started this effort, like everyone said, 3 years ago, and I was helping with our veteran offender group, and so I'm going to call to the stage folks that are going to help me talk about what we did in this roundtable over the last couple of years. And if I can have Tim Bushkin and Richard Robertson up, and if the other members of the other groups can come up too at the same time and sit at the chairs, and that way maybe we'll have a little less transition time. Stephen, great. Cody, just a few minutes of transition. Thank you. Shannon, thank you. Everybody? All right. So our groups were really dynamic, and as you can imagine, lots of discussion and lots of effort. So, like I said, who will be the speakers today? Can I have the next slide? So the first round table group, our big question was, how can we better assist our justice-involved veterans? And that had many spokes and many wheels and lots of discussions. And we're just going to take you through a high level of what we discussed and the main areas we talked about. So Tim Horshkin's going to help me lead through that. And Rick, if you want to step in as well at any time, please let us know. Rick is representing our Department of Corrections, who has really been there to come up and find ways to help our veterans who are in the correction facility. So, Tim, I'm going to turn it over to you.
Good morning. Welcome and thank you for attendance today and your participation in this conference here. I have the honor to tell you about the initiatives that stakeholders from the Justice Involved group have worked on. Next slide. The proposed question, just how can we provide better services to our Justice Involved veterans? This brief will kind of present to you with some of the results of their hard work. This work began years ago. Leading the charge from your WDBA was our own Mary Forbes, and the group first met 36 months ago in 2019. And today we will show you the progress that we made and how the stakeholders met this challenge. Slide. This is a list of our active stakeholders. Many others were involved early on in the process, and still many new volunteers continue to contribute additional information. You can see here we have representation from the VA Regional Office in Seattle, the Department of Corrections, Veteran Health Administration, and your WDBA. I want to take a moment to point out a few members on this list. First, we have new regional navigators, Greg Robinson and Brandon Wells, Andrew Parnell from our Department of Corrections, and then myself from your WDBA. Slide, please. Stakeholder group came together to address how do we better serve veterans in the justice system. The group recognized the need to provide access to services. So first, we needed to identify who was an eligible veteran, provide a way to communicate, and then provide access to the VSO and other resources. The group met monthly virtually and worked towards some goals they felt were achievable and provide the best services to incarcerated veterans. The group updated DOC policy and renamed it the Veteran Service Policy and created descriptions for new staff and brought in others that might have resources to assist in the re-entry process. Through much collaboration and cooperation between the VA Regional Office in Seattle and the Veteran Health VA training was received, and this further enhanced the process of providing justice-involved veterans benefits. Once the COVID restrictions lifted, Tony Sparber, if you would stand please. Okay. And myself were able to do some outreach in our local correctional facilities around the state. During this outreach, we were able to hear about issues of access from veterans, determine the eligibility of benefits, and educate and answer questions for incarcerated and Department of Corrections staff. Additionally, the hiring of 2 full-time navigators, my colleague Greg here and Brandon Wells, we were able to help to increase the efficiency and management of the reentry team meetings and to coordinate for those being released back into the community. Next slide. So here are the problems the group addressed. The first one, removing barriers to applying for VA benefits. The issue, of course, here for incarcerated veterans, they have no access to computers, phones, VSOs, and often their mailing address has not been updated with the VA. They are incarcerated, they're moving around. The solutions that the group came up with consisted of utilizing kiosks within the correctional facilities with a specific distribution list for veterans to make inquiries and communicate with DOC staff. Additionally, updating and maintaining a veteran POC list at each of the facilities and making connections with those counselors, those classification counselors. We hired 2 new reentry navigators, hired myself, a program specialist, and updated the veteran policy. Next one. Sorry, go back. The second here was to assist the process of CMP exams in the DOC facilities. VA healthcare does not authorize while incarcerated. However, CMP exams are okay to be completed while they are incarcerated. The VBA, Veteran Benefit Administration, implemented contractual service for CMP exams and to be completed even while incarcerated. So CMP exams have hit or miss, or hit and miss sometimes. So the group took effort to help assist this process. It was determined that the DOC would cover the cost to off-site facilities as necessary. The Department of Corrections also will have essential POC to oversee coordination for CMP exams. And the work done to hire and provide access to incarcerated individuals opens possibilities for veterans to apply for compensation benefits while they are still incarcerated. The third term on the list here is apportionment for dependents, which is the next challenge that the group addressed. This requires the veteran to self-identify as a veteran receiving benefits, connecting to a VSO, and then connecting to the family to complete the paperwork. When a veteran is incarcerated, the family may lose substantial income and face hardship. So if the family can show financial need, then they may be able to receive an apportionment of that veteran's compensation. The fourth item here is overpayment is created when a veteran becomes incarcerated for a felony and the VA compensation is not stopped when they are incarcerated and when they receive a pension. Now, it also must be reduced when receiving compensation for disabilities. Prison match process can be slow when the Veteran Benefit Administration needs to confirm, prison match, and then they have to send a notification out to the veterans to confirm the decision or appeal the decision. The results lead to several months of overpayment, which is not likely to be paid by the VBA as the incarcerated veteran receives all their care through the state. These are showing 3 broad focus areas that the group put emphasis on with their time, with much collaboration. The first one, new positions to assist with successful reentry into the community. The second one, enhanced process with applying for benefits through providing referral services by way of your WDVA. And 3, updating the DOC policy, which included the name title change, among other corrections, and veteran services policy. through collaboration of all the stakeholders in public at comments period, and those with shared interest participated in making those final comments, and the final draft now appears is with the Secretary of the Department of Corrections for final approval. Okay, from the previous slide, top three focus areas, the slide shows how the stakeholder group got to where we are today. Focus area number one, creating new positions to assist in the reentry process. Matches goal number one, enhancing the reintegration experience. The major push came last year in 2021 and involved in gaining DOC support, secretary support for additional positions. This led to meeting and developing those position descriptions, advertising, and hiring the 2 Department of Corrections navigators. There's still optimism that the Department of Corrections will hire a veteran service manager in the future. But thanks to OTED support, they're providing facilitation of the 18-month follow-up. We were re-energized as a group and moved the team forward. Focus area number 2, enhancing access to providing referrals and resources was a goal. Matching number 2 on the slide previous, which also puts emphasis on enhancing the reintegration process. And this involved getting your WDVA, ALFI, director support for hiring a program specialist to support justice-involved veterans, and that led to me being hired last year in July. Now, OTED supported that by spearheading the facilitation at the 18th month follow-up. Focus area number 3, enhanced collaboration and result in updating the Department of Corrections policy, which leads to goal number 3, resulting in overhauling that veteran service policy to include new job dates and updating veteran POCs at each of the 12 facilities around the state. Public review and comments have been completed, and that final draft is ready for final approval and release. Next slide. So in summary, the group wanted to provide better services to our incarcerated veterans. It came down to identifying 3 challenges. Challenge 1 was to stop or reduce benefits as soon as possible upon incarceration. The group's response to this was to update and provide a welcome packet at reception, where members can self-identify as having served in the military. This leads to identifying veterans through shared agreements and collaboration, bringing about notification to the VA of confinement and helping determine if the apportionment is needed or requested for dependent. Challenge 2 is assisting veterans during incarceration with applying for benefits and obtaining compensation and pension exams. And this is a heavy lift and involves communication with veterans, POCs at 12 institutions, help coordinating, facilitating, and advocating for incarcerated veterans. It has led to establishing a single point of contact for healthcare services to oversee conditions for the compensation and pension exam. It also has led to my hiring myself of application procedures for benefits and helping provide status of VA claims. The third challenge here is to restore benefits. To meet this challenge, the DOC hired 2 full-time navigators, Rick and Brandon, to bridge the gap from correctional facilities to community reentry. The WDVA hired me as a program specialist to coordinate and refer 2 resources in the community. The Veteran Health Administration has 1 dedicated health care for reentry specialists. That's our Tony Sparker back there in the back to connect veterans to health care. So as you can see, significant progress has been made. The stakeholders know there's much work to do, and they are dedicated, a bunch of individuals serving veterans and are committed to meeting the challenges and providing better services to justice-involved veterans. I think we'll be followed by some questions.
Next slide. This time we have about, we scheduled a couple minutes in here that if anyone would like to discuss anything or have any questions regarding the justice involved roundtable, the work that they did. Any questions or comments on that? We've got some microphones. Oh, there we got one right back there. I see that hand. Is there another? There's another. Okay, great. All right, we'll get the microphone. Sherelle right back here. Raise your hand, yes, sir. Thank you. And then we'll go over here next. Okay? And then we'll go here. So when you do state your name, organization, and if you have a question for a specific person, let them know.
Okay. Hey, my name is Chris Diaz. I'm out of Skagit County. I'm the new Veteran Service Officer for Skagit County. I've worked with the VGOs down in Snohomish County, got some training with them to figure out how we can get to Skagit County Correctional Facility, and with Snohomish County being in that area larger than ours in Skagit County, we figured out a tablet would be the best way to introduce them to our VGO group at Skagit County. And I have a buy-in from the chief, from the office. Some of the things that I've been working on for Skagit County, this was a big right off the bat when I got hired. The nurse, part of our community service team, asked me that question, like, hey, is there services out there for incarcerated veterans? And I said yes. And then from there, we're about to have a pamphlet turned county-wide and into the correction facility. But some of our stakeholders are Skagit Valley College Education Team, high-impact team by Skagit County Sheriff's Department, myself, another DSO, VGOs, HVRP, so that's the homeless veterans down in Snohomish County, which their grant reaches up to us. Community service organizations like Community Action and others that are around our county, Skagit County. So basically, when they check in, they're going to be seeing this pamphlet, just like you guys were talking about, the packet. And then from there, they're going to say, yes, I'm a veteran. Please help, connect me with the VSO, VGOs, HVRP, and basically hand them the golden ticket. So when they get out, they're not just getting a bus ticket to nowhere. They have an address to go to, a phone number to be at, and I think, I don't know if you guys heard the story about 4 weeks ago, we lost a 20-year veteran on our interstate in Anderson who decided after he got out, he went straight to the freeway and jumped in front of a truck. And I'm not trying to down anything, but I think if we were into that Skagit County Correctional Facility and had visible paperwork at the time, maybe we could have made a difference for him and his family. So I guess my point is it might be just a little bit more personal than operational. So connecting the outside services, so they basically like a warm handoff. I think that'll work really well. So if I can connect with somebody to get more information for Skagit County, we're about to turn this pamphlet all over the county and get our veteran justice outreach for our county. Thank you.
For left.
Yeah, if you,
Push it one more time. You keep it there, you go.
yeah, we would like to, if we can, connect with you afterwards and talk about this more, how we can come together as a team and make that happen.
Okay, so we've got Tim connecting with you. Okay, Cheryl, the other one's, the gentleman's over here, right there. Cheryl. Then we're going over here.
Hello. I'm Dave Sturgill. I'm the director of the Kittitas County Veterans College. I want to thank you guys for instituting this program. I called WDVA a year ago asking to speak to the incarcerated veteran specialist, which I knew had existed in the past, and was told there wasn't one. So thank you for implementing this. My question is similar to Skagit County. We have justice-involved veterans at our county prison, our county jail. And while the briefing today has done a great job talking all about statewide DOC problems, we could use some assistance with our justice-involved veterans at the county level as well. And I just would like to hear you talk about that, how you could help us. Because those men and women are, even at the county jail, still have felonies and still encounter substantial barriers to reentry into productive society. Thank you.
Excellent point. Really appreciate that. I think what I'd like to do is we have our King County staff here, or representatives from King County. Because King County does have a program, and we operate that with subcontract. And there's a lot of conversation I think we need to have with leaders to see how we can pull us around your county leadership and how we can help show them really the return on investment of investing in this type of program. So do we have some folks, do we have anyone here from King County that we can, instead of this conversation, oh yes, here, right here.
In the back.
Here, and then in the back, is that Gretchen back there? Gretchen, okay. And your name again, sir?
It's David Sturgill
David Sturgill.
from the Kittitas County Veterans Coalition.
Awesome. So I'm going to think after, maybe we can meet up here, Gretchen, and just have a conversation, exchange. I think this is super powerful in both cases, is that we learn some of the best practices. It might not look exactly the same in your county, but if we can really approach it from having these discussions with our elected officials, our county leaders, our HR leaders, those are the folks that are paying bills when bad things happen, whether they're veterans coming out of facilities or other veterans. And we want to work on those policies and those funding opportunities to really switch the narrative, right? Like if we can raise up the veteran as they're coming out, as you talked about over here, and I'm sorry, your name again?
Chris.
Then can we work back upstream and prevent, right? And that was so powerful that you said that, so thank you both for your comments.
Thank you. Now we're going to go over here. Yeah.
Hi, my name is Delina Josephson, and I'm with the Transitional Housing Program. My question was about it's about the apportionment. So would that apportionment given to dependents, would that also create an overpayment? And then would that start at 61 as well?
No, the apportionment would not create overpayment to the veteran. The apportionment process takes a little bit to get going. As applied for, obviously, it has to be the one that will determine to get the apportionment, but it does not lead to overpayment.
Hello? All right. No, exactly what you said. We don't create additional hardships on veterans with apportionment.
Okay, thank you.
Okay, so great discussion. I tell you, I went to the National Association of Drug and Veteran Court Conference 2 weeks ago, and just have to tell you, Washington is setting the standard when it comes to justice-involved veteran rehabilitation and trying to get this right. And so, great things, Chris, David, thank you very much. If you have questions and you didn't want to comment, Tim and his group will meet down here at the front as soon as we end it, so please come. Again, no clicks and comments, today is conversation. So this is where we can connect. They can learn about things that happen at the county level, the special program level, and we're going to have those opportunities right after this event. So we're going to go to our next group, and thank you all for those questions. What we're going to do is we're going to go to our next group, and this is going to be led by Mr. Stephen Gill. He is the Veteran Service Administrator and Tribal Liaison for WDVA. It's 21 years with the agency, so we have a newbie here. 21 years, Mr. Gill has been administrator for many programs, including the Veterans Benefit and Disability Claims Assistance, the Homeless Service and Transitional Housing, Representative Payee and Fiduciary Services for veterans who recently transitioned from military service, and an outreach and case management service for veterans involved with the justice system. Stephen is a United States Army veteran, there we go again, and recipient of the Washington Governor's Award for Leadership and Management and the Governor's Award, I love this one, for Customer Service. That's great, we need more of those. That's great. And Stephen is going to lead our second roundtable brief out focused on rural veterans. Steve, thank you.
is such a pleasure to be here today after taking a few years of a pause due to the pandemic. Virtual meetings, virtual conferences just don't replace this. They don't replace the opportunity for us to come together and network and connect and learn about each other's programs and services in such a unique way. As mentioned, my name is Steve Gill. I'm the Veteran Services Administrator and Tribal Liaison for your Washington State Department of Veterans Affairs. I first came to the agency in 2001, so I had been around a few years. I did not need these glasses in 2001. So I'm squinting a little bit. Just bear with me. I want to make sure we cover all the work that we've been doing in the past few years to focus on outreach and improving access to services for rural veterans. Veterans, we need allies, right? We need friends and families and partners. We need you in the community, tribes and counties and nonprofits to help us through networking, through overlapping programs and services, through coming together like this to make connections. And when we started this work with the Office of Transition and Economic Development, a little over 3 years ago, well, we've been doing that work for a long time. Let's get that straight, right? But when OTED came in and started helping us about 3 years ago, we had a new opportunity, and that was an opportunity to bring together some new partners, to think about things in a different way, to look at some of the ways that we were providing services, and it really talked about, okay, what are the resources that we each have as an organization, as an individual? How can we leverage those resources, overlap those resources? What are the gaps? What are we hearing in the communities around the state? And how can we fill those gaps with the resources that we have? How can we increase resources to fill those gaps? How can we bring additional partners in that might bring resources, staff members, and knowledge, and volunteers of their own to help fill those gaps? So a few of the panel members or group members that were also part of that group that I'd like to introduce is Laveda Anderson. Laveda is a tribal veteran representative and tribal veteran service officer with the Squamish tribe and with the Utah tribe in Washington State. And was one of the first tribal veteran service officers accredited through our partnerships with Indian tribes in Washington State. We have 29 federally recognized Indian tribes in Washington. We also have 39 counties in this, so there's a lot of work we've been doing with counties, and we're going to come back to that as well. Stephen Stroke, we met from the VA Regional Office, Service Center Manager. It was Stephen, myself, Laveda, and some other partners in the room. Mark Sullivan, one of WDVA's employees, manager for our transition and readiness council, military transition readiness council. And we had other partners there too. We had nonprofit partners, we had county partners. There was a lot of folks that were there as part of that conversation. So we wanted to, with the problem that we had, I was supposed to do this once, forgot about that. Okay. How do we improve access to claims assistance in healthcare in rural areas? That was the challenge. That's what folks were telling us. We need to improve access for VA disability, claims assistance, compensation, and pension benefits, and access to healthcare. So, why is that important? I think we know why that's important, but just a little bit of background. We know that a veteran that's receiving VA disability benefits, either compensation or pension, on average, receives about $1,500 a month in VA disability benefits. So payments that go directly to their bank account. That could be $4,000 or $5,000 or $6,000 a month if they have a higher disability rate or they have dependents. We know that money doesn't solve all of our problems, but man, it sure goes a long way towards solving some of our problems, right? Especially with access to housing, affordability being an issue. We also wanted to focus on health care outcomes. We know that veterans enrolled in VA health care have better health care outcomes. They have reduced rates of suicide than veterans who are not. So we wanted to focus on health care outcomes and access to VA disability benefits. Next slide, please. So we wanted to do that both at the rural level in some of the rural counties and with the tribes. And with the tribes, it's not just rural, but it also includes urban Indians, Native American veterans, Alaskan Natives that might be in urban areas. So we came to the table and we started talking about what are the resources we have, what are the partners we have, and how can we work on improving access to those benefits. Next slide, please. Well, man, I certainly can't read that. Here, so talk a little bit about each of these areas, what we did at the tribal level, what we did at the state level, and what our federal partners helped us with. And then when we get to Q&A, they'll get Anderson, Steve, and Stroke here as well. So at the tribal level, I'm also the tribal liaison for our agency. In Washington State, all state agencies have a tribal liaison. We're really focused on outreach and education and awareness first with tribal leaders, helping tribal leaders understand and be aware of all of those benefits and programs and services that are out there. A lot of those tribal leaders are veterans themselves. They were willing and ready to listen, but we needed allies. We needed tribal veterans representatives and tribal veteran service officers from tribal communities to help us deliver that message, and make sure that message was culturally appropriate, that we were providing culturally competent services to those veterans and those families in Indian country. So we worked with some of the existing groups that were out there, like the Joint American Indian Veterans Advisory Council, and the affiliated tribes of the Northwest Indians Veterans Committee, to bring federal VA, the healthcare side, the benefit side, the cemetery administrations, to bring them into those groups to talk with tribal leaders, tribal veteran representatives, tribal veteran service officers. Leveda and her colleagues, the tribal veteran service officers, tribal veteran representatives that were out there, were a tremendous help in doing that and putting those groups together and getting folks like me from the outside, FaceTime with tribal leaders, to talk about these programs and services and to share a meal together, to talk about what we did in the military together, to go out to tribal communities and make those visits out in the field. We travel all around the state, and I'm probably on my third or fourth state car at this point, because I keep running them out, driving all over the state to visit with tribal leaders and county leaders. We also looked at how can we provide technical assistance and training to tribal veteran service officers. How can we get them accredited in the same way or in a similar way to the way that state and county veteran service officers are accredited service officers. Some of that work had been happening already. The VA Office of Tribal Government Relations was pushing to help us get some of that done. So we started scheduling training events. In fact, just this week, Monday and Tuesday of this week, Leda and myself and some of you all in the room are at a tribal veteran service officer training event hosted by the Squamish Tribe. So we talk about disability benefits and healthcare eligibility and how to access those benefits and systems and rules and all those technical things that service officers need to know. Those tribal veteran service officers that can go back out to their communities and help veterans and families in those communities understand those benefits and really get started. We provide the accreditation as a veteran service officer. We provide access to information systems, tools to help those tribal veteran service officers have tools they need to do their job effectively, and to have a network, someone to answer the phone on the other end. I may have to make a phone call and say, hey, how does this benefit work? What forms are there? Why is their payment working right? Or on the healthcare side, is there a point of contact in VA Puget Sound, VA Spokane, the Walla Medical Center, Portland Medical Center? How do we get this veteran in the door? Eligibility, what's their priority group, access to services, community care? How do we break down these barriers? And now that folks are coming together in these meetings, first in person, and then we went virtual for a while, we created those opportunities to make connections, to have phone numbers, and to remove some of those barriers that sometimes exist, just because we have to have rules and processes and things like that. But those networks are incredibly important. At the county level, going back 11 or 12 years, Washington State did not have any county veteran service officers in our state. And 11 or 12 years ago, some of the rural counties in Washington State, Okanagan County, Chelan County, where we're at today, and others started saying, hey, we would like to have a county veteran service officer. We looked around the country, there's other states and counties that are doing this. WDVA, how can you help us develop a county veteran service officer program? So Mary and I went and we looked at those rules and said, what authority do we have? What can we do? What resources do we have? And we developed a program where we could sign memorandums of agreements with counties to provide veteran service officer training, accreditation, access to information systems, technical assistance, training conferences, so that we can help those county veteran service service officers in the field connect with those veterans and families, help them apply for those benefits, enroll in VA healthcare, all those other things that are important to that veteran and their family. And today we have 1920 of those agreements with counties in Washington State. We've gone to the next slide already, so thank you. One of the other things that happened for the counties is there was some legislation introduced in Washington State at the request of counties, through talking to their elected officials, that created a pilot program for county veteran service officer funding. Because not all counties, especially rural counties, have the resources to fund that veteran service officer position. So legislation was passed to create a pilot program for county veteran service officers. Started with 2 rural counties, and that was recently expanded to 4 rural counties in Washington State. Are receiving some pilot funds to help them develop and stand up county veteran service officer programs. Some of those counties are in the room today. Thank you guys for being here. We're going to hear from some of you in the breakout session. And those other counties that are those 19 or 20 that I mentioned, some of you are also in the room today. And we can offer that same technical support and ensure that we have a level playing field with you. And have the same tools and resources that the National Veteran Service Organization might have, or that state veteran service officer might have. On the federal level, our federal VA partners are incredibly important, both from the Benefits Administration. And Benefits Administration really helped us with showing up to our training events, to train those new tribal and those new county veteran service officers. Doing claims clinics. We had some claim clinics and outreach events hosted in Indian country, hosted by the tribes. VA brought their the VA regional office team, the eligibility folks that come from the healthcare side, and the Cemetery Administration, who is also here with us today. And then the pandemic happened, right? So we had to move some things virtual. So we started, the VA regional office started doing their WebEx Wednesdays, which were kind of technically oriented, ins and outs of benefits that service officers could join and we can learn about something new every month. The state partnered with that, and we started doing training virtually. And the stakeholder engagement groups, nonprofit veteran service organizations, the tribes, the counties, and the state come together in a virtual format to learn more about the technical ins and outs of those benefits, healthcare administration, to talk about eligibility and priority groups and community care and everything that was going on there, the expansion of VA benefits even prior to the PACT Act recently. So we looked at, okay, what are the existing resources, the existing that we have, the existing personnel, the knowledge that we can share, and it doesn't always take new resources to bridge into those gaps. So we really focused on existing resources, but there were also some new resources that came along the way that certainly helps. Next slide, please. So the milestones and the achievements. In Washington State today, there are 7 Indian tribes that have memorandums of agreement with Washington Department of Veterans Affairs to provide accreditation training for the veteran service officers. There are other tribes that have tribal veteran representatives in place that are also doing this type of work. Some of them are partnering with nonprofit veteran service organizations, the American Legions, the Disabled American Veterans, the VFWs. So we looked at how can we partner with existing organizations and tribal leaders. Part of our tribal veterans event we did earlier this week with bringing tribal leaders to the table, as I mentioned earlier, that talk about those programs and services, and talk about other benefits as well, whether it's survivors benefits, dependents benefits, employment benefits, education benefits, the VA home loan guarantee, Indian country, the Native American Direct Home Loan Program, or VA Indian Health Service tribal reimbursement agreements. There's a lot of that dig in there in terms of benefits and healthcare, and some unique programs for tribal veterans that work on the reservation for some of the traditional programs like the home loan guarantee, and just don't work because of the way that that the land is held. So, in summary, and next slide, please. Engagement with tribal leaders, expansion of tribal veteran representatives and tribal veteran service officer programs, expansion of county veteran service officer programs, collaborating around training, education awareness, resources, access to information systems, and tools at those tribal and County Veteran Service Officers lead the expansion of the funding for the pilot County Veteran Service Officer Program, which was a rural County Veteran Service Officer Program, not legislation, not pilot, specific to rural counties. And then our federal partners helping us with education and awareness in terms of the ins and outs of benefits, eligibility, application process, some of the technical things that service officers need to know to be a good service officer, those WebEx training stays, and direct engagement, those VA claims clinics, coming up to communities in rural areas with Indian tribes, and really doing that direct engagement to show veterans and families in the community, that there's an opportunity for direct engagement. I know the VA regional office in particular also has opportunities for telephone and virtual engagement with a live person, which has been great, especially during the pandemic. It was hard to do an in-person visit. And then with our healthcare partners and the National Cemetery Administration also showing up to come out and talk about eligibility, to talk about burial benefits, survivors benefits, and everything that comes along with that. Now, there are a lot more details to all of this than I go over. We hit the 30,000 foot level right here. So I think we'll open it up to questions and also allow Stephen or Beta to take questions about the regional office or the tribal programs as well. Yes, sir.
Second question.
We've got the mic runner, so give us just a minute to get the mic together.
Hey, it's Chris again from Skagit County. So, my kids are Samish tribal members. My ex-wife is a Samish tribal member. My ex-father-in-law is an Upper Skagit member, and a lot of family from Swinomish. The problem I'm having as a VSO in this county is I've contacted them, I've knocked on the door, dropped cards off, and I get the life living on those different areas. They kind of enclose the doors and stuff like that. So if I could get, share my information and maybe be a part of a meeting or something to help get into these areas because they don't have it and they need it. And I've had a couple people that work out in the Swinomish tribe. Hey, you got to come over here. I'm like, okay, well, help me out. Get me connected so I can get in there, and I'll just give me a little office of privacy, and I'll take care of everything else. But I think we need some more, like for VSO counties, like to get some introductions to those different tribes, so that way we can get connected and help them out. And maybe that'll start the conversation. Maybe get their own VSOs, stuff like that. So.
Yeah, thank you, Chris. In fact, the Joint American Indian Veterans Advisory Council meetings are open to partners. So coming to those meetings is a great opportunity to network and connect with some of the tribal veteran representatives. And I want to mention Skagit County was one of the counties that we stood up a county veteran service officer program. Chris, we talked on the phone, we've done all of our training, but we've never met. So I look forward to getting a chance to meet you. That we've stood up in the past few years. That has been part of this work. So thank you again, Chris. We have one question. Okay, thank you.
Thank you. I'm Kristen Ashley, and I'm with Bedford. I'm also with the Kittitas County Veteran Coalition. And I know that our leadership in Kittitas County is aware that our veterans need support and they want to support them. We do have difficulty with funding. I'm curious about the trajectory of the state-funded pilot program that you're doing, if there's opportunities for growth, and if our county can apply for help, because I know that we need it.
Yeah, thank you. It's very likely that the pilot funding will grow, that the funding through that program will be expanded in future years. It's based in legislation. So as that legislation is passed, that says grow the program, we'll be putting out requests for proposals, opportunities for additional counties to apply for that funding. And that funding is specifically for rural counties, for counties with fewer than 100,000 people. So we started with 2, we went to 4. The legislation says that we will do 2 counties in Eastern Washington, 2 counties in Western Washington. And if that bucket of resources expands in the future, we'll be putting out a request for proposals and look forward to seeing proposals from Kittitas County and others.
Where would we locate that?
I'll leave a card with you. Yeah, it's going to be on our website. Anytime we put out requests for proposals, website, but I'll also leave a card with you because I'm the person that you call, that to talk about it. And for that matter, I am happy to come out to meet with county leaders, to meet with veterans advisory boards at the county level. I've done that quite a bit. Same with the tribes. I'm happy to come out and talk to tribal leaders, talk to advisory boards at the tribal level, to talk about the programs, eligibility, how they work, and when resources are available. I'm usually putting out messages to my network to say, hey, there's resources available. We'd sure like to see a grant application.
Excellent.
Hello. Hello, Ray Hernandez, Yakima County Veterans Program. The question I have is, I grew up on the Yakima Reservation.
The other mic's coming your way there.
Oh, okay.
Yep.
Wow. Okay. Ray Hernandez, Yakima County Veteran Program. The question I have is, I'm not an enrolled member, but I did grow up on the Yakima Reservation. Are you seeing that more tribal members are starting to participate with claims and stuff when you have somebody located on the tribe that's an enrolled, or not even enrolled member from their tribe, but some kind of Native American representative? Just because I know that there's a huge culture difference, and in some cases a lack of trust towards the government agencies that I've recognized on the Yakima Reservation.
Yes and yes. We need culturally appropriate services in order to deliver the services, help veterans and families access those benefits. I see a microphone that's kind of close to Leveda over there. I want to invite Leveda to talk about that a little bit too, because Leveda has been the key to helping us do that.
So, at the application, okay. Am I there yet? In the application, we have one of the largest lawyers, and we have a new vet center, and we have a new upcoming accredited service officer. As Steve mentioned, we just had a training in that room there. It is a trust issue. We're working and walking in the country. But all my partners, my stakeholders, we've had a great honor and the opportunity to work with, and OTED that shared things with our lawyers and the largest we have served most carriers. We are reaching out and finding out more and more that when we walk with them and introduce them, they network very well in the system. As a TVSO, we start from the beginning, call it the A to T, from the A to T, and we do the full round of services. It's not handoff and go from BHA to BBA. So we have a joint coordination with our partners. And yes, they are stepping up more. And Steve said, I'm involved with this finished training this week. Our JVAC was meeting September at 7 Cedars in the Jamestown Slalom Tribe. And as I too want to mention to Chris, that your upper Skagit and your Sauk Sounds up there in the swimming show are part of our partnership. So if we can reach out and help you assist you, this is trust policy, but those barriers are being opened and as we call it, it's being a shared process and a progressive.
And Steve, if I can jump in on the federal side, I'm glad that you brought up the trust issues, because they're huge. They did not start during any of our lifetimes. They're not going to be resolved during any of our lifetimes. We all have to work together. As Steve said, we are so blessed to have Leveda here, the first tribal representative. We also have a national VA tribal liaison, Terry Bentley, who's been fantastic working with tribal groups. For our regional office, we have instituted some claims clinics. To the Cowboys tribe, the Mosack tribe. Macaw Nation as well. but we are trying to get out there. And again, I'm calling on you all because you get into a lot more places than we can. These work with veterans. We want to hear from them. We want them to file their plans, whatever.
Hi, my name is Courtney Van Hiller. I'm from Gonzaga University of Spokane. My family is chair of the Umatilla Nez and I just wanted to know if we don't have a area that we can go to, or if we're not a part of that, if there's someone we can send our veterans to become a part of that, or maybe not even become part of that, but just be able to send them somewhere.
Yes, we welcome all our traditional tribes. In our affiliated tribes of Northwest Indians, where we have our Veterans Committee, there's also Oregon and Idaho. And our Nez brothers and sisters also have a veterans program down there. They have a TDR, a tribal veteran representative, yet to become accredited through the Idaho Department of Veterans Affairs. And for us to be accredited, Steve can explain that our partnership with our tribes, that we privately provide the training and the accreditation. There has to be a memorandum of understanding, and not all tribal veteran representatives want to be VSO. But like I said, we try to encourage that, but we're welcome to have you join us, and we will probably have all my cards and my email, and see, of course, the network, and we can work with the tribes and the tribal council.
Thank you.
You bet.
American Indian Veterans Advisory Council, which is really Western Washington. Eastern Washington has the American Indian Veterans Advisory Council. That's hosted by VA, Spokane Medical Center, VA Medical Center. So there are two regional groups, as well as affiliated tribes in the Northwest Indians, which is like the Pacific Northwest. Question in the middle here.
No,
My name is Harvey Mills Jr. I'm a TVA for the Caldwell Confederated Tribes. I was going to tell the lady, we have the AVAC meetings monthly at Spokane VA Hospital, and that includes the Caldwells, the Spokanes, Espers. We're trying to get the Coeur d'Alenes and the Kalispels, but they don't have any veterans apparently. But they do meet monthly, so you can come in. It's an open meeting. You can come and present your whatever you want to do there, and we'll begin. Thank you.
Thank you, Harvey. Okay, this will be our last question, and then we'll move to the next group. Needless to say, we will be here the rest of the conference, so find me in the hallways and happy to talk.
My name is Terry Graves, Cowlitz Indian Tribe, Tribal Veterans Rep, and Service Officer. So I want to share with my other tribal and native folks. When we sign that MOU, we don't sign over our sovereignty. They're still supposed to come to the table. The WDVA is supposed to come to the table as equals and with us, and not look down at us, but to work with us as in partnership. So I just signed on in February, I think it was number 6. Alfie and Steve came and signed a contract to the MOU with our Cowlitz Indian tribe. And so I do want to say something about the trust issue to the gentleman sitting up there by Levada. No one showed up to that Cowlitz outreach. I was there, I sat there and watched. So I was not involved in the planning of that outreach, and so you have to come to the table with us as equals and include us in that planning, or it will fall on its face like it did that day. I just sat back and thought, I'll just sit and watch and see what happens. But had I been involved, all the natives in that southwestern area that I know as veterans I feel like we would have had a line. I just sat back and watched because I didn't know who the stakeholders were. I didn't know what the plan was. I was not included in any of that, except can we use your building? And then that went over my head to my executive director. So you have to come to us because it is a huge trust issue. I had to deal with the VA with one of my Native veterans, and Puget Sound VA, I had that discussion with them. You guys should know trauma-informed care because you work with veterans on a daily basis. Is that not true? And they said, that is true. I said, now you take it up another level because we're natives. And the government's been trying to kill us all for years. And so we have a huge trust issue. It's not sometimes, Steve. It's all the time. You walk in the door, you need to earn that trust with us. You have TVRs out here in this audience that probably part of the reason they don't want to be as accredited is because that fear of what does that mean that I have to be dictated to by the VA or the state or whatever. When we have sovereignty and we don't sign over our sovereignty, we do not. And so we're equals in this partnership and we need to be treated as such. And Steve, you've been wonderful about that. I know Alfie's been wonderful about that. Dr. Pruitt's been wonderful about that. And I appreciate you and I raise my hands for that work because you do get it. You do come to the table with us. You do shake our hands and sit down and have a meal with us and share those stories like we did the other night. It was really powerful. So I do raise my hands, but it is really, really a huge trust issue. Yes, I'm a white passing native. That gets me in the door. It gets me up in that room where I'm able to speak. I look up on that panel right now and I only see about 30% that are BIPOC. And I can't say it because I'm white passing that I don't know that any of those are white passing BIPOC people. But I think it's important that we have more representation. As in the previous conversation about our incarcerated, we call it the Iron House. You know, those coming out of the Iron House. And how come I don't see more BIPOC representing? Because we tend to be the ones that get arrested and thrown in jail more. And I didn't see that in the pictures. I didn't see it on the board. I see a 30% up there right now. And so I think you have to think about that and think about the trust issues, especially, you know, not just with us natives, but BIPOCs in general. So thank you.
Terry, thank you for being here and thank you for your words.
Thank you for everyone. Great closing comment about the work we but that doesn't mean we've got it all perfect. We can continue to go toward that goal of getting it perfect. And so with that, we're going to move to our next group, and that's going to be led by our friend who's already spoke to us, Dr. Larry Pruitt. Dr. Larry Pruitt is going to talk to us about at-risk veterans and obviously his specialty and what he's doing, what the team did to help address that.
Thanks again. At-risk veterans is kind of a nebulous term. And you heard Alfie say it earlier today that regardless of the issue, regardless of whether it's substance abuse, PTSD, finances, or divorce, what we're trying to present is the bottom left side of the path. We're trying to prevent veteran suicide. So I'm honored to be able to talk to you a little bit today about what we've been doing to address that. And we'll be going back to Cody Garza in a little bit to share some of the work she's been doing as well. Excellent. And go ahead.
Can't hear you back here, Larry.
Sorry about that. Okay, so what's the goal? The goal is to destigmatize health seeking. Bottom line. We know that veterans are high risk for suicide. We also know that they don't tend to seek care at the rates we would like them to. We know that we have effective treatments in the short term for individuals that are at risk for suicide. step away from that immediate crisis is going to be at risk. Right? So if you ask me to pick somebody in the audience who 1 year from now is going to be at risk of suicide, do it in your role to ask. Okay. But if there was somebody who was in crisis and needed that support, needed some treatment, needed to talk to a physician or a psychologist or a social worker, that's the easy part. But we have to get folks in the door first. We have to make sure that we have a healthcare system that works for them. So to do that, we realize that we can't just take a clinical approach. We have to have both sides of the equation represented. We need the clinical services, of course, but we also have to have public health focused interventions, right? To identify and welcome individuals at risk into care before it becomes a crisis. And so to do that, we have to look at who are going to be our helpers in this. There was just not enough space on the slide to give you a comprehensive list, but I put these folks up here because this is a good representation of how broad we approach this program. We have the state, we have the federal representation, we have our military representatives, we have nonprofit agencies that are serving veterans, state legislators, all of which are focused on this common issue of veteran suicide prevention. Next. Okay, so when we initially sat down back in 2019 to start this work, we thought, well, how can we do this? What would be sort of that entry point? And Mike has mentioned a couple times about clicks and likes to represent social media. And well, maybe that's the venue to start social media. Anybody here remember Rally Point, the veteran social media? Yeah. So that was where we were going to start. And so we developed a plan to create a number of command posts on rallypoint.com to really address some of those key upstream issues around suicide prevention. So family issues, relationship breakups, parenting, post-traumatic growth, lethal means safety, those sorts of things. And to really give voice to those. We thought we were going to be really ambitious. We were going to try and hit 50,000 likes, 50,000 impressions, right? We didn't know that was going to be possible. It seemed like a big number. Along with that, we were kind of presented with an opportunity to expand this a little bit. In conjunction with OTED, there's also programs called the Liaison and Governor's Challenge. So we embarked as a team on this Governor's Challenge effort. And that effort was really about, again, bringing partners together. Including going to talk more about specific initiatives in that, but bringing partners together that would normally be working independently to work together on these common issues. And so through a proclamation from Governor Inslee, we started building a team, of some of which are in the room. Actually, if you are part of the Governor's Challenge, can you stand up? Yeah, so a lot of the same faces we're seeing are working behind the scenes on this Governor's Challenge initiative. The goal is to really develop threefold areas. How do we identify service members and veterans at risk, including family members? How do we promote connectedness and entry into care? And how do we promote safe environments and people need safety for veterans who we know need that added level of time and space between them and the means in which they might die by suicide. Next slide. So to do all of that work, we said we need a structure, we need some sort of guidance, right? And so we looked at the U.S. Department of Veterans Affairs National Strategy for Preventing Suicide. That's the big overarching circle that was all under. Within that, we said we need to follow the evidence. We need this to be informed by research, and we need to do what we know works. And so that's that next circle, because of evidence-based practices. And within that are all those colored pieces representing the different lines of effort. What I want you to pay attention to is that the yellow ones are those medical or clinical services. You see that that's not the entire puzzle, right? There's a lot of other stuff that goes on. There are community-focused interventions, there are public health-focused interventions, there are economic-focused interventions. The things that these other groups that have been talking about veterans hand it over to Cody Garza. I'd like to send a photo to as my partner in crime, but I realize that that's not the right term. So I'll call her partner in service. She's with the Washington State Department of Veterans Affairs.
I don't know, I think Larry and I get into trouble a lot, so maybe crime's a good representation. Go ahead and go to the next slide. So ours is a little bit different because we created this beautiful statewide strategic plan with the help of, not a lot of people didn't stand up. There's a lot of people in this audience that are part of the governor's funds that didn't want to be recognized. But we had a lot of different people from different agencies and organizations, and so we created this amazing, large strategic plan. And so I kind of want to just go over those pieces in a broad overview. If you're extremely interested in the details, it's actually available on our website, and we're going to be reporting to the legislature on the outcomes of that strategic plan, the implementation of that strategic plan in a few months. So within our first, already mentioned, it was about identifying service members, veterans, and families in the first place. How do you know you are serving anybody in particular and have access to those specific resources or address those unique risk and protective factors for suicide if you don't even know who you're dealing with? And so we wanted to try to find ways to encourage that identification. And that's kind of that community side that Larry was talking about. And on the clinical side of screening for suicide risk, we understand that there's not consistent screening across the board, and so really trying to promote that consistent screening in cases where our military veteran community are engaging with providers is essential. And then on top of all of that, we know that sometimes it's hard to know for various reasons, whether it be cultural or communication barriers, for us to know when somebody is suffering from suicide ideation. And so screening is sometimes not enough, right? These questions that we ask, these lists of questions that we ask in a clinical setting may not be enough. And so another aspect of that group was to improve help-seeking behavior. We want to improve, we want to encourage our service members and veterans and military families to actually reach out for care. But the only way we can do that is to create an environment in which they feel safe to do that. And we understand those barriers that might prevent them from being able to speak out on that. So that was our first section. And then our second was that promoting connectedness and care transition. And again, and this is this theme, right? This promoting connectedness, that's community, that's about us, that's people within the community and talking to each other and building teams of people. And then we have this improving that care transition, that clinical piece, in collaboration with those two things. So that looks like the informed healthcare providers, right? So that they can provide culturally, when I'm speaking culturally, I'm talking about our veterans and military community. There's a different kind of communication style. There are different kinds of unique risk and protective factors that they need to understand, exposures. And so making sure that our providers are really educated and understand what the military veteran community kind of has in their past that may influence how they receive care now. And then also, I guess, boosting up those peer services and peer teams in the community. There's somebody out there, people are out there working so hard to get veterans connected to whatever resources that they need. It's about making sure that those connections are made all the way through. And so, Larry likes to say, we have a no phone number policy. So what we're really trying to do is to make sure that the community is aware of that, and then to find out who those people are, who those agencies and organizations are, and make sure that our veterans are getting the quickest, best access to the right resources that they need. And a lot of that happens through peers. A lot of that happens through trusted messengers, people that they feel comfortable with, and it's not always people like being in a nice outfit, wearing a badge that says state government, and we recognize that, so we're trying to really boost those peer services. And then lastly, making sure that those community programs are sufficiently funded. Whether have the money or they are aware of those opportunities, we hope that that's the case for our state. Because Larry said it's not about us, it's not about me, it's not about Larry, it's about doing work and work done as a team. And the team is you, the team is everybody. You're all doing suicide prevention. So the last one is all about lethal and safety. And I think it seems a little bit scary, but a lot of it is education and awareness, and not just education and awareness for those that are in crisis, but education and awareness for providers to be able to communicate with their clients, with their patients on lethal and safety and the best practices in that case, and really understanding how to have that non-judgmental conversation with those clients and those patients, where they can find a collaborative approach to staying safe in crisis. Next slide. So, as Larry mentioned, we had a pretty high goal of 50,000 impressions. And so that's for that first piece that Larry mentioned about the rally point articles. And so for 12 months, we wanted to do every 2 months an article that is put on the front page, the rally page, but basically it's spotlighted so people that could interact with it can understand it. And it was all based around mental health and suicide prevention. Some of these are from the viewpoint of a military spouse. I myself am a military spouse, not a veteran. And I work in public health. So I have a little bit of a different perspective than the military does. And then we had others that were veterans themselves. And some of them that were mental health care providers. And so it was a good broad range of information and communication to the military veteran community. And so we were able to specifically identify topics that we wanted to talk about that would encourage an environment for people to have conversations about suicide prevention and mental health. And then we, thanks to OTED, of course, we were able to make that connection with Rally Point. We were thinking, how are we going to do this? Where are we going to put this social media post? And Rally Point is there, and is a great connection for us to be able to say, this is the best place where we can reach those people. Within that second category, as Larry mentioned, we embarked on this journey of the Governor's Challenge, which now 49 states and many territories are participating in. I just came back a couple weeks ago, Larry and I did, from a conference in DC. We got to see all of those that were participating. It was so amazing. And the best thing about this is that it is specific to your state. So what you currently have going, what you know are the gaps, what you know are the amazing resources, you can leverage that for your state. And you can find ways to make sure that it's in line with what the larger VA says. This is the evidence-based kind of way of preventing suicide or reducing suicide. And so we got to bring together this amazing, diverse team of people that is still growing and changing as we find more gaps and more opportunities. And we continue to meet. It says 2025 on there. I say there's no expiration date. So, and we created this strategic plan, which you saw before, and like I said, it's a 30-page document, so if you are into reading, go right ahead and go read it. So we're continuing to implement those things, and in December we'll have a report out to the legislature to talk about all of those amazing activities that are involved in this. And just to name a few, some of them are transition planning programs like guest sponsorship. Some of them are asking the question and encouraging people in the community to ask the question whether or not somebody served in the armed forces. Some are education programs for providers, as I mentioned before, about lethal safety. It's just such a broad range, and a lot of it has to do with the partners that are involved and how, finding ways where they can leverage their skills, their connections to make things work and make things happen. And lastly, and this is, I think, the most recent and notable thing about our strategic plan. When we created the strategic plan, one of the things that we were told is identify those barriers and say, look, we're going to try to do this the best as we can. But you know what would be awesome? If these barriers were removed. There are all these things that might make this a little bit more difficult. And so sure enough, there's a page in there that talks about recommendations and barriers to being able to actually implement the plan. And luckily, legislative bodies looked at it action. We see our community working to reduce suicide, and we care about this population. Let's try to make this happen. So just this last legislative session, House Bill 81 was passed, which you see up there, it's a lot of tiny things. I apologize for that, and I don't expect you to read it. But the reason this reason is so tiny is because there's so much in that bill to benefit our community, and it's just so overwhelming, and it almost made me feel emotional to see so much amazing work happening. And so a lot of that, I talked about that funding piece. We're creating a grant, a suicide prevention community grant program, where we're going to be able to kind of bring in revenue from actually a creation of an emblem for the military and veterans suicide prevention that would go on a license plate. And the revenue from that, or donations, can go into this account, and eventually a grant will be paid out to those that are in the community working on peer services, specifically around suicide prevention and wellness for our military and veteran community. So that's that piece of making sure that our community and our programs are sufficiently funded. And so we've got that going. We've got amazing work with our peer team. We actually, in the process of all this, rolled out a peer suicide prevention peer team that goes out to some education all across the state that regionally located. And with this, we brought on a rural suicide prevention peer specialist. Mostly because we understand and we identify that we're moving into a new age time with using the internet and using all of these tools. And we still know that there are a lot of people that don't have access to this, don't feel the need to use those things, and really just want to talk to people. And maybe they need specific cultural, a specific kind of cultural communication to get them involved, to get them to, again, creating that environment, right, for people to seek help. And so our rural suicide prevention specialist started a couple of weeks ago, and he's already getting kind of in with those communities that may be a little bit more remote, and so hopefully he can bring those communities in, because we know that our state is so large and diverse, and a lot of rural populations that don't always make the connection. We hear so much about everyone in our state. And then on top of all of that, we have something called a resource database that we're working on. Legislation had asked for us to create a resource database for all of our military and veteran and military families to be able to access to find out what resources are out there specifically for them. So we created a criteria, we're working on a web-based application, and we're creating an application itself for agencies and organizations to be put onto this resource database, and creating a system for all of that. So that anybody, if you're a VSO or somebody working at any sort of community organization, or you're a veteran yourself and you need to connect a veteran or connect yourself to any sort of resource, it's a lot less stressful than trying to Google your way into some sort of resource. Because what we identified is that there are unique needs that our community has, and sometimes Google isn't enough, and sometimes we also want to talk to people, and that's okay. And so this is kind of helping provide that opportunity. And then in addition, we have our peer specialists if you do want to talk to somebody, and they can walk you through that process as well. So, next slide. Oh, I had to mention, OTED in that case for the governor's challenge and for the legislation really helped make those connections and helped us identify where those gaps were just in that first meeting. The governor's challenge first began in 2020, early 2020, and when we met and kind of started the rally point stuff, we met in, I think it was early 2020, so around the same time, and it was like, we don't know what to do. What are the gaps? What are the opportunities? Who should we be talking to? And that conversation getting started really helped us identify those individuals. So lastly, Larry talked about that ambitious goal. And kind of our results, he mentioned our results. We got thousands of reviews. We got upvotes, which is kind of like a like on Facebook, and a bunch of comments and people engaging. And the best thing about those comments and those rally point posts is that it's not just comments to me, it's not just comments to Larry or any of our authors of those posts, but it's also comments back and forth, communication happening between military service members and veterans about these topics, and able to really digest the information that they're receiving, which is great. And then with the governor's challenge, we were able to create an action plan and a strategic plan that we're continuing to implement and we're continuing to grow and improve. Lastly, that bill was passed to reduce veteran suicide and really to honor our veterans and our service members that have faced suicide. I think the next step is questions and answers. So I'm going to sit back down. Thank you.
We need to model some of her energy and spread it around. What a great job. So let's go to our first question right here. Yes, sir.
My name is Gill. I'm a Vietnam veteran, and y'all know the problems that the problem between the government and the Vietnam veteran, no matter if it's Indian or black or white or whatever. I've been going to a lot of meetings and been recommending this over and over and over again. You know, when I was drafted, that's why I'm a veteran. Anyway, when you get into the basic, you know, I spent 8 weeks in basic, and all I did was teach you to kill, nothing else, just kill. I've been asking, and you guys up there, you know, you have the brains, and you probably have the wherewithal to start getting this process done. But why can't the Army or whoever service you're in, I'm not sure how to say this, detrain that veteran? You know, put him through a 8-week course of making him human again, and making him get rid of some of those things that he's seen and that he's done. Now that didn't go a long ways to doing away with the continuous killing yourself. And that's still going on, you know. It's been going on for, hell, I was in Vietnam in '69, and they were saying people were, you know, killing themselves and coming home. Here he is, 2022. They're still killing themselves. And we come to these meetings and we're doing this, we're doing that. Why are they still killing themselves? My next recommendation is, again, I'm a Vietnam veteran. And I didn't trust anybody for 100 years. It's working up towards that process where you can talk to people and talk to people in authority. They ask you a bunch of dumb questions all the time, and you know it gets really tiresome. But anyway, why can't the brain power come up with a way to where we can get these veterans to come in and see us? You know, we're there. Everybody says we're there to help. We're there to serve, and we are. But I have a son-in-law. He was in 3 tours: Iran, Iraq, Afghanistan twice. I said, what the hell? And he screwed up because I've been talking for quite a while, and he's real proud of killing people, of learning how to kill people. Man, you know, you got a problem. And we've been talking and talking, and he's coming around, and he wants to do something about his situation. But we need some way of having those younger veterans come in to us so we can get them that help. and prevent them from killing themselves as the alternative because I always tell Baveda and everybody else, the goddamn government made us this way. They're responsible for us. And I mean that. I mean, you know, they, like I said, when I first started, 8 weeks of teaching you to kill in different ways. You know, 100,000 ways to kill a person, but no damn way to keep them alive if they make it back home.
Well, first of all, thank you for your service in Vietnam, and we can never say that enough. I had 3 combat tours and 9 deployments. I got a big welcome home every time I came home, but you didn't. So to every Vietnam veteran that's in this room, thank you. We owe you a debt we'll never be able to pay.
Difficult realities that are real. And I want to stand up and answer those questions because you're asking for that. The piece about rerunning is a challenging one, and if we have to answer that, like Mike was saying, bottle that and give it to everybody. We don't have that knowledge yet. What we do have is we know that when folks leave the service, they're at a particularly high-risk period, and multiple times the other risks that they would have during that first 12 months transition. And so one of the pieces of the governor's challenge is really focused on what we call the deadly gap, that 12 months after they leave the service. And going back to what you're saying, when you're in the military, you are changing duty stations, for example, you get somebody to welcome you to wherever you're going. Right? They show you around, they give you the lay of the land, they show you where your office is going to be, they show you where the barracks are, they show you where your kids are going to go to school, whatever it might be. They say, hey, here's where your CEO's office is, those sorts of things. There's not an equivalent program for when somebody exits the service, right? And so that's what we're trying to bring is how do we take that navigated experience, that guide, that mentorship, and when a new service member separates from the military, they're met with somebody in their local community. So if they're, ETSing to Wenatchee, if there's going to be a veteran or a sponsor, a volunteer from Wenatchee, that's going to pick them up as a mentor and walk them through, hey, get inside, again, here's where the schools are for your kids. Here's some jobs that you might be interested in. And we're partnering with communities to do that and build that network of mentors and sponsors. And so you might know that by some of the water tables, there's volunteer handouts and flyers. That's to get involved in that program. If you are interested in serving as a mentor to a transitioning service member, you can sign up and enter sort of a pool to help those folks transition after you go through some basic training around suicide prevention for one, but also the veterans benefits, the VA, so that we can make those connections happen for them instead of, like you said, relying on them to opt in the care, which we know doesn't happen as frequently as we'd like. We're setting that up so that they have to opt out if they don't want to.
The reason I keep calling David is I served with basic training with the David program, so it's flashback. Sorry. David Hall. Next question. Yes, sir.
Thank you. My name is Ed. I work for World Source in Kings Out. I won't be standing over here. When you're talking about being able to make people more comfortable with reaching out, a large part of that has to be removing the stigma of reaching out, and particularly for veterans who come from a macho environment, that's not a gender-related word. The stigma of reaching out is deep. And I'm encouraged encouraged seeing a lot of the advertisement that I'm seeing on TV and such, but this has to start before you exit. This has to start when you're still in the military and you're being prepared for that exit, and you're being told what you have just been taught is not normal, and you're going to encounter an identity crisis when you hit civilian life. That's where it really has to begin, when you still have, but before they're dumped into the post-military acid pool, and being told that this is your new normal. I'm just wondering if you can elaborate how that is being addressed before the problem rears its ugly head, because that seems to be the logical place to get it started.
So I'll start and then the folks can jump in. So one, the program I was just mentioning, we try to connect with folks in the 6 months prior to separation so that they aren't just, exiting and doing their 1 or 2 week course as they separate and then they're on their own. We're trying to work with them ahead of that to make sure that they have an understanding of what those differences are, what their needs are going to be, and who they might reach out to for that support. In addition to that, we know that care seeking, that help seeking behavior is a hard thing to do for anybody, but especially people that are veterans. And so one of the other efforts that we're really engaged in is trying to train healthcare providers outside of the VA to ask that question, right? And not just healthcare providers, but first responders as well. To ask about military service so they know, okay, what are the individual factors that I need to be aware of for this person so I can help customize the services and care that they're going to receive. And so, we know that only about a third of the veterans in our catchment area receive care at the VA. So they're getting care at other places, and we want to reach out to those places and to those providers and say, hey, there are some things you need to be aware of. There's some risk factors that we should know about that are especially salient with this population. And we need you to understand their culture. Because if you're not asking about it and you're not really taking those things into account, you're not treating that whole individual. And so that's really where our focus is making sure that we have a community that supports that health seeking so that they have an opportunity to do so.
Yeah. Oh, sorry. Thanks. I wanted to jump in on my question. I Larry had a good point. The exchanges started working with Providence to provide some kind of short cultural things through Psych Armor to their medical providers, and sometimes it's a little bit harder to get them all in the room for a 3-hour training or a workshop. But to give them that understanding, that background, that cultural understanding, so that they can look for certain signs. In addition to that, though, I will say, our agency likes to put a lot of focus on the community, not just veterans themselves, but those military families. When we look at our data in Washington State, we look at our veterans that are dying by suicide, most of the time, the only person they talk to is their intimate partner. They're the closest to it, right? Their caregiver, their life partner. And so we like to put a big emphasis on that military family because, unfortunately, sometimes our service members, our veterans, are not talking to their providers about these mental health issues. They're not even sometimes talking to their friends or their brothers and sisters. And so another thing that we do in the community is we provide something called veteran cultural engagement workshops. And that is to get the community, whether it's an organization, an agency, or just a community member, a spouse, a veteran themselves, to really understand veteran culture. Part of that is understanding that battle into home mind transition and what it might look like, right? So looking at what does it look like on the battlefield and what might that look like in the community? What might that look like in a civilian world? And how can we find ways to integrate, in a healthy way? And then also, how do people like me, as a spouse, find ways to communicate with my veteran to be able to get to the bottom, of whatever's going on, to be able to get that person help. In addition to that, the VA itself, the federal VA also has something called coaching and care, which if you're a caregiver of a veteran and you need them to seek treatment, then you can call them and they can help you through that process. There are a lot of resources that help not just veterans, but again, creating that environment and really leveraging the people that love our veterans to help make that connection for them.
Cody, what was the name of that program? Something of Care that will be in?
Oh, Coaching into Care.
Coaching into Care.
Yes.
Thank you.
We go to Mary, and we have one more question, and we'll just go to our close.
Yes, thank you. Yeah, just back to what Larry talked about in ETS sponsorship. It's etssponsorship.com, and to your point is that program is being made mandatory by the Army side first, and they're starting with 3rd Corps in Texas because, to your point, working upstream while they're still on active duty to connect with a sponsor of like culture, right, in your community. So please pick up those brochures. I know we're getting short on time, but this is the opportunity for you to have a connection with an active duty soldier coming up in transition, and then help them, steer their pathway to success. So it's out there.
The brochure again?
It's etssponsorship.com, and I know they're outside.
Those are on the tables directly out of these doors on the right.
And we need sponsors. We need all of you to just take on one veteran. Thank you.
Okay, over here, last question.
Hi, my name is Patricia Stewart, and I have the opportunity to work at one of the only American job centers that is located on a military base. That would be WorkSource JPLM. And I can shed light on some of that question. From the beginning, and as a veteran, from the beginning, I was always told to avoid mental health, go into behavioral health. It would affect my security clearance. It would negatively impact my career. Then when I got out, just going from trying to navigate the system from the Army, where I just called, I made an appointment, I didn't have to worry about, is it covered, am I seeing the right person to get to the whatever. The first time I tried to make the first time I went to the VA after I got out, they told me that the medication that I was on was too expensive, so that they needed to adjust it. This is after years of getting the medication right, where I wouldn't have panic attacks, where I could be able to function. So that wasn't really something that I wanted to hear right then. So I went to I called the doctor, and when I said that this was the medication that I was looking for, I was looking to see a provider so that I could get mental health help because I needed to re-up my medication. They made me feel, they told me that they couldn't help me, and then I had to go to a psychiatrist. Luckily, being an NCO and being there for other people, I called my mom and I cried for like an hour. And then the next day I drove up to that doctor's office to tell them that if that is their basic care, they're killing people. And all of this is to say that culture hasn't changed. I had a customer that was going in yesterday that asked me, after I built up like weeks of trust, asked me if it was really okay for her to claim behavioral health from MST because she was being told by her leadership it was going to affect her civilian career. Especially with female veterans, we're always talked over in veteran spaces. And it's not any better for the spouses too, because sometimes spouses are looked at as less than because they're not the veterans, which is BS because they're holding up their veteran. And I didn't expect to get so impassioned, but this starts with those the people that see them first, like a WorkSource counselor. There are times I had to stop an appointment so that I could get my veteran, because she was a military spouse coming from Fort Hood. They rushed her through the SFL TAP process to just get her out the door. And so now she was in front of me as a military spouse, and she was in crisis, and so I had to stop the appointment, give her the walk-in information to the VA, but because as a state employee, I couldn't take her or anything like that. So I had to have her take my number, you text me when you get there. If there's any problems, text me and come back here and we will figure something else out. That's not something that you're trained to do. That comes from my military background. So my question is, why aren't these peer counseling or even suicide interventions being trained to workforce counselors, DevOps, leavers? There are people like the healthcare system. You guys are awesome. You can't do it alone. Because again, we've been told not to see you guys from way back in the beginning of our career. And also, I will also say, as a Gulf War veteran, we owe our debt to the Vietnam veterans that went through absolute hell and advocated for us. So I just want to say thank you.
Hey, first of all, no one ever should feel bad about being passionate about our veterans, so never worry about that.
So the Department of, so based on the Work First program, which is a collaboration between the ESD and the Department of Social Health and Services, they have something called Strategies for Success, which is it's like an 8-week course, and it kind of teaches you how to adult and how to human in a workplace with others. I think something just like that catered towards veterans would just be immeasurable. But there's also the dual thing. It's not that the resources aren't out there. Sometimes they're hard to find, but there's also a command. If you're, say, a 21-year-old and you're getting chaptered, say, for not showing up to formation on time or testing positive for marijuana, as soon as they kick you out, they are done with you, and they let you know from the start that they don't care about you. And so you have to overcome that. And then, like, for the people that have been there a long time, again, with that whole personality or just identity shift. There was a transition report done by the VA in 2018 that showed that right under navigating the VA system, finding employment was the second most area of stress for veterans. And if a veteran, after they get out, experience homelessness, they're 2-3 times more likely to commit suicide. So again, why aren't there more AJCs in every base?
Thank you very much. Jerry, first in fact, let me just lead into Janet now, since that was an excellent segue to hear from someone in the Department of Labor Vets. That is going to be Shannon Langdon. She is the Washington State Director of the United States Department of Labor Vets, which is Veteran Employment and Training Service, known as DOLS. Shannon has held that since 2018. She collaborates with other partners. I think you're going to hear some of the very issues that you have so eloquently brought up, addressed by Shannon here in just a minute. Prior to that position, from 2014 to 2015, she served as a coordinator for Oregon Employment Department of Veterans Employer Program and worked in human resources and career counseling for veterans, which is going to be great to hear. And she's a veteran, I'm sorry to say, of the United States Army. This is the part I love, because if you're in the military, you're going to love these type people. So she was a NBC specialist, which stands for nuclear, biological, and chemical. She was the one that has some Mach 4 for 18 hours a day. We didn't do that. She was an NBC specialist and deployed to Germany. She was stationed in Fort Bragg, where she served as the battalion nuclear, biological, and chemical training subject matter expert and the battalion training sergeant. It's great to have her here. Please welcome Ms. Shannon Langdon.
being such a great part. Really, a lot of times when you say, hey, I'm from the federal government, I'm here to help you, people are not usually as welcoming as the state of Washington is. So the thing about DOL votes is we're small, but we're mighty, and we could never do our job without the rest of you. So we represent the entire state of Washington. There is a DOL that's represented in every state, including Puerto Rico, Virgin Islands, Guam, I think they have. But we're a very small agency. There's 4 of us, me and my fabulous assistant directors, Christina Vine and Diane Hunter, and Nicole Weimer. But there's 4 of us total that cover the entire state. That's kind of hard. And our mission sounds very easy, but it's not that easy. So we're the only agency under the Department of Labor that focuses on providing transition service members, military spouses, and veterans employment. Sounds pretty cut and dry, right? It's not. Turns out that's a pretty big task. And we literally could not do that task without our partners. So I just wanted to highlight a couple of the programs that we administer and how we work effectively with those partners, and some programs that you may be interested in applying for. So one of the things that we focus on is when we're providing employment opportunities to transitional service members, military spouses, and veterans, is we focus on those veterans that have what we call significant barriers to employment. So homeless veterans, recently incarcerated, currently incarcerated, disabled veterans, those veterans that need the most help. Now, as we all know, trying to put a square peg in a round hole does not work out. You cannot try to say, here's a job, if there are other barriers that need to be addressed. If they have mental health barriers, or if they don't know where their next meal is going to come from, or if they're homeless, or they're recently incarcerated. And that's why it's so important that we have such a great partnership with the WDA, because we can maximize our services to help those veterans. Our agency, which we're called the VA all the time, we're not, but our agency is primarily staffed by veterans and military spouses. So it's veterans and military spouses helping other veterans and their families. So one of the ways that we do that is through administrative grants. One of the grants we administer is the Jobs for Veterans State Grant. That's administered to employment departments throughout the country. Now, she mentioned WorkSource, and she did a great plug for WorkSource and all the services they provide. Let me ask you guys a question, and there's quite a few of them in the room. Has anybody here ever heard of the term DBOP? Oh my goodness, that's wonderful. Those are the folks that work under the Jobs for Veterans State Grant. Those are the folks in those WorkSource centers providing those one-on-one employment services to those veterans that need the help so much. And Strategies for Success course is excellent. So that's a very good idea. It's an excellent course. Another way that we help veterans is through the Homeless Veterans Reintegration Program grant. Now, usually this grant is provided to nonprofit organizations, and it's one of the only grants that focuses on helping homeless veterans and at-risk for homelessness veterans find employment. We are very unique in the respect that our grant is actually administered through the Washington Department of Veterans Affairs. I don't know if this is true. I have not known of any other state that has had the grant administered through the Department of Veterans Affairs. That's huge. They cover almost the entire state. And we can maximize those services. They can bring all those wonderful services that WDA provides to veterans along with the grant funding that we provide. We also provide guidance and assistance. Sometimes we're looked at as red officers. Well, we're not. We're not in D.C. We're in Washington State. We're here. We want to partner with you. We want to help our fellow veterans. So speaking of the HRP grant, this is kind of under the umbrella of HRP. Has anybody here heard of something called stand-in? We provide funds for stand-ins. You can apply for a stand-in at any time. You can get $7,000 for 1 day and $10,000 for 2 days. And you apply directly through our office. Like literally, you can email me and say, say, hey, where's the application materials I'd like to apply? So if you're in an area where you know there's a lot of homesteaders, where you know a stand-down resource fair, and for those of you that may not know what a stand-down is, it is literally a homeless veteran resource fair, basically. I mean, tons of service providers are there, employers that are willing to work with those that are homeless to help them find good jobs. Mental health providers, there's usually surplus gear handed out. It's huge. It's huge because all those basic resources that homeless veterans need are provided in one place. So if you're in an area where you know that's something that's a huge need, talk to us. Talk to my assistant directors. We're always, we don't have unlimited funding. It's funding available. But we try to do everything we possibly can to help you get that application processed and approved. So if you want to know more about stand-ups, please contact us. Let's see here. Another big piece, I'm not talking about everything we do, just in that time, right? But another big thing that we do is we protect service members' rights in the workplace. Service members and veterans. Who here has heard the term called USERA? Oh, yeah. Okay. Well, I thought. So that's Uniform Services Employment and Reemployment Rights Act. We are the agency that's tasked with protecting service members' rights in the workplace. We are also the agency that's tasked with educating employers. So if you're an employer and you hire a lot of veterans, you have a lot of National Guard and Reservists that work for you, and you want to know how best can I support those veterans and service members in the workplace? How best can I make sure that I'm doing my due diligence to support them in the military service? Come talk to us. We provide presentations and training on how best to support those veterans and service members in the workplace. Because let's be honest, if you're the National Guard Reserves, they say, okay, 2 weeks a year, 1 week a month. But that's not really the case. A lot of times, you may be driving 6-7 hours, from your workplace to a drill or to a train. Or you may be deployed. And you want to make sure when you get back that you have a job waiting for you. That employer doesn't just arbitrarily go, well, you're wrong here. We had to fill it somewhere. Sorry. That's where USERA comes in. So educating yourself on your rights as a service member or veteran, or as an employer, is huge. So if you want to know about USERA, if you want some training on USERA, please contact us. If you're interested in applying for stand-down funding, contact us. If you're interested in the HVRP, the Homeless Veterans Reintegration Program grant, talk to us about it. We are not the ones that approve it. It has to kind of go above our level, but we can tell you this is what it's for. Here are the application materials. Here's what goes into that application. So, like I said, we're a small agency, but we're mighty. We're only mighty due to the partners that we have. The partners out here, the partners sitting here. In order for the JPSD program, the DFOS neighbors, we wouldn't be able to reach out to rural veterans or have connections with Native American veterans. If you work with HVRP grant through WDA, there would be homeless veterans throughout the state who wouldn't even know about the benefits of that teaching. They wouldn't even know here are these programs here at WDA. So I say all that to say I appreciate partnerships that we have. If you're interested in some of the services we provide, if you want to apply for a grant, if you want to know about USERA, we're here. We have a table with candy, by the way. With candy. Okay. So we have a table. It's out here and around by the after apples. I think it's Gala and Fuji. Come here to the table, talk to us. Yes, we're from the federal government, but we're like the federal government, right? So here we represent Washington State. Thank you so much for inviting me up here so we can talk about our Middle of the Mighty program. Thank you again. I hope everybody has a great time at the conference.
We're out of time. We have one last closing speaker. I know that there are more questions than we've been able to compensate for today. So the panelists have agreed to stay up here right after this and stay there as long as they need. If you've got questions, concerns, ideas, please come up here right after this, and we'll let someone will stay. stay as long as we need to stay to listen and hear and try to get answers out there. Our closing speaker is Shante Sampson. She is from the Outreach, Transition, and Economic Development team in Washington, D.C. for the Department of Veterans Affairs. This is for, I love her this, she's a Navy veteran. Listen, 26 years of service. She was in Kuwait, Iraq, I can't pronounce that, Africa, Djibouti, okay. All of support of there's a storm, there's a shield, there's a freedom, a right to freedom. And this is what I understand. So, Navy vet, retired veteran. She has the Army Commendation Medal. A Navy and Marine Corps Commendation Medals, 4 awards. The Navy and Marine Corps Achievement Medals, of course. And then Fleet Marine Force and Expeditionary Warfare Designators and various other campaign awards. I had this long thing to read over. She doesn't like that, so I'm just going to say, please welcome to Shante Sampson.
Can you guys hear me? Yes. All right, again, welcome. Thank you. Thank you all for being here. Today has just been so much rich discussion. And it's been amazing. I got chills. I'll be remiss if I did not mention my boss, Executive Director Cheryl Rawls, from the Office of Outreach, Transition, and Economic Development back in Washington, D.C. He tasked me with this project, Economic Development, 3 years ago. And Puget Sound was my first event. And it has been a true partnership. It's been a true experience. So that group for best practices. So, and my team, I've got a wonderful team that keeps me focused, keeps me on track, and we all work together to do these events. So I'm going to just give you a little bit of information about Outreach, Transition, and Economic Development. We are fall under Veterans Benefits Administration. We have 6 programs, but Economic Development is our best program. And I have to say that because of the work that we do. We call ourselves the conduit, where we bring transitioning service members, veterans, family members, spouses, and caregivers to their benefits and services. And we do that by way of outreach. If we're not reaching out, we're not outreaching. And we totally did that in Puget Sound. Like I said, it was our first event that we ever went to. My boss said, what the success look like? I said, I don't know. But we now know. So I'd like to thank Alfie and Mary and Dr. Ford, Cody, and the team that worked together with us. This one was unique because this is our closeout for our 36th month. In the past, we've done 6 months, 18 months, and 36 months. So we changed our plan a little bit, our cadence, but we said we wasn't going to do that with people. So that's when we came back, and then when they asked us to partner with serving those who serve, we said this is going to be a big win. So again, thank you for allowing us to come. Economic development initiatives, we do that by connecting the transitioning service members, veterans, spouses, and caregivers to those benefits and services that they need. But in an economic development world, what we do is we come to these areas of underserved populations that has been identified by the IRS based on social economic factors like employability, like health care, like education levels, like college, things of that nature, and homeless to name a few. So we're going to come into your community, help you identify what your challenges are, and then we're going to come up with mitigations for those challenges. And that's what each and every one of those family members did today with those 3 groups that we sustained for the last 3 years. So again, thank you for all the hard work that you all have done. Our events can consist of town hall roundtables, benefits fairs, presentations, all kinds of things that we know that's going to provide resources to those transitioning service members. financial literacy topics, and we garnered over 43,000 attendees. So we're happy about the results of that. What I need for you all to do today is take those resources to your veterans, your transitioning service members, your military spouses, because we all want everyone to be economically developed and stable as they transition from civilian to military, from military to civilian life. I know myself, after 26 years in the military, I was scared. I didn't know what kind of job I was going to have. My money, it was good, but it wasn't going to last me forever. So I utilized and capitalized on all those resources that we have. So we ask that everyone in here tell the next person about a resource, help the next person to assist them. I've got public partnership. That's another one of our taskers that we lead out. We're always looking to partner. We have this strong partnership with the state of Washington. It's just been so enjoyable. I'm just so full of it right now because this is what we wanted. 36 months, we wanted to hear all the great practices. Right now, currently my office is working on 6 other financial literacy MOUs. So in the future, there'll be more resources that we ask you to share and share life to help the next person. All right, and another part of my Wellness Wednesday is we partner with Prudential, who provides a customary digital website that you can go into and customize your financial needs to whatever's going to work for you. It's education, credit monitoring, safe practices, skip reduction and scam and frauds, just to name a few. And then our literacy program, on the third Wednesday of each month, we have 2 sessions where we have experts come in who will discuss various topics, education, just to name a few. So you get the opportunity to log on to that site. It's credential.com/better. Okay, next slide. Trying to get through this because I know we're between lunch right now. If you'd be so kind, we have an assessment, and there's the QRC code there. It takes a few minutes to do, and this is going to help us better our process. So just focus your smartphone camera, click on the link, it'll take you right to the survey. So we ask that you complete that for us. And in closing, our promise to you is to continue our commitments, our relationships, and providing powerful information to those veterans transitioning service members through our partnerships. For FY23, we're going to invite you into our annual symposiums. We want all of you guys to come to DC to spend some time with us. And it'll be all the other economic development folks that we've met throughout the last couple of years. So I'd like to say thank you again. At this time, I'd like to bring Ms. Mary Forbes up. She'll be final closing. Thank you.
And just so much awesome material. I feel we didn't answer your question, but you can come up afterwards. I really wanted to talk with you and answer your question. Very powerful. We have lots of training and a lot of opportunities. And to your point, we worked super hard to get recognition of getting that first American Job Center on Joint Base List report. That was a gigantic effort. That was the Secretary of our Employment Security Department, our Commissioner, right, agreeing to that and see Joint Base List report as a city, right, as a city. So lots of important things that we have done over the years, and it's constellation. All of you are part of our constellation. You've heard that. The teamwork, the coaching analogy. We cannot do it without all of you. And we hope that all of these talks this morning now inspire you to see how you're going to be able to bring this together for our veterans and families, where you live, where you go to school, where you make things happen, right? We need some of the parts, we need all of you. Now it's time for lunch. You have your schedules, okay, so lots of really great classes, all starting at 1 o'clock and tomorrow. So this will be our last time together. Lunch is right outside these doors. Again, I super appreciate every single one of you, all of our presenters, all of you who have come here today and tomorrow. And I will end it with that and just salute you all and thank you from the bottom of my heart. So thank you.